periodontal ligament आता है, then we have alveolar bone, and also we have cementum, right? Abhi, one more thing that what we can do with this tissue engineering is we can we can induce artificial bones and gain the volume of the bone, wherein which we can use for implants. Abhi jaise alveolar ridge hai, one of the criteria for implanting is that its width and height. One of the criteria which we considered before doing an implant inside a patient. Abhi मान लो for some instance we need to gain 2 mm extra, because maximum gain that can be is 2 mm for the alveolar ridge. We can gain that through tissue engineering, है ना? In a similar fashion, suppose our implant is going too close to our sinus, तो हम उस केस में जो क्या करेंगे, the floor of the sinus जो है, we can augment it and get better results before going for an implant. Or next will be cell seeding purposes. It's not much of use to us, but yes, cell seeding is the first stage of cell attachment and its efficacy and distribution that can affect the final biological performance of the scaffold. And finally, not the least, is drug delivery. HA is also used as an agent for drug delivery. Kyun? Because it's present in the extracellular matrix, wherein it has a high biocompatibility, that's it's non-reactive with our tissues, and once as a drug delivery agent, it does the purpose of doing the drug delivery. Uske baad, it is easily biodegradable without any complications, and also it's non-toxic. So a very good option for our drug delivery agent. Next would be properties of hyaluronic acid in relation to inflammation, tissue healing, and regeneration. For us, brief terms which are important for us, and what does it mean actually? Abhi, it's hygroscopic. Hygroscopic is ability of any substance to absorb moisture or water from the surrounding environment. ठीक है ना? This is one. Second thing is it's viscoelastic. अभी जब viscoelastic बोला तो क्या हुआ? It's viscous as well as elastic. But it is viscous and elastic. ये complete term तब होगी when it is under deformation. For example, somebody just pokes my cheek like this. It has gained back its original this. So it is deformation and regaining back the original form. That's why it has viscoelastic properties and helps us so. Then its bacteriostatic effect, you all know. It inhibits the growth, it prevents the growth of bacteria at the site of maybe wound or in this surgical area. When it is bacteriostatic in nature, we have a better post-operative result. As simple as that. Next would be it's biocompatible. Yes, it is biocompatible, as I said. It has a high, it's inert with our body. It doesn't react with our body. Therefore, we can easily manipulate, use, and have innovations with this material as well at our personal levels also. But of course, clinical trial is very important. We cannot just go blindly and do anything with it. Then it has anti-inflammatory properties. Yes, it has anti-inflammatory properties because it actually interferes with interleukin-1 beta. I'll come again to that later. So it does not allow the inflammation to come, and if at all it will just reduce it at a much faster pace than if we leave it the nature to take care of. Then it's also anti-edematous. Abhi anti-edematous क्यों हुआ ये? Because it has the ability to absorb moisture. So when it has the ability to do so, obviously the edema will come down, and we can have advantage with that as well. The next would be its non-antigenicity. Non-antigenicity जो है, it means that our immune system, it's non-reactive to our immune system. So mostly post periodontal surgeries, if we there are jellies also, hyaluronic acid jellies also. We have many different types of formations and formulations in the market. So post periodontal surgeries, or post extraction, if we place it in the sockets, it is definitely not allowing, it does not make our immune system to react to it. That's where we get the link for biocompatibility. So it's so. Then it is also antioxidant. Free radicals in the body, if the concentration of free radicals increases within our blood, definitely it's very harmful to us. So it's antioxidant as well. Coming to the next slide would be process of wound healing. अभी हम generally बात करेंगे ना, एक general wound कैसे heal होता है. It has 4 stages. Wound healing की 4 stages हैं. First is immediate, that's obviously hemostasis. Second is inflammation. उसके बाद inflammation will start. Then third one is proliferation. There will be granulation tissue will come into play, and lastly it will be remodeling. अभी इनका एक टाइम फ्रेम है, बट दे ऑल दी स्टेजेस दे ओवरलैप ईच अदर. किसी का ऐसे फिक्स्ड नहीं है कि 1 से 4 दिन तक ये हुआ, 4 से 8 दिन तक ये हुआ, ऐसा नहीं है. Say it's 1 to 4 days, then the other process may start in between because it's conversion from one stage to another. So it will just go overlap. These stages will overlap. अभी hemostasis की हम बात करेंगे तो hemostasis में क्या होगा? The purpose of hemostasis is कि this will close the wound by a blood clot. That's called hemostasis. Closure of a wound by blood clot is called hemostasis. इसमें हमारा क्या होगा? One more thing that will help into it is vasoconstriction. We all know the blood vessels will constrict, and that will reduce the flow of the blood from the vessels to the site of mechanical injury, and thereby the blood flow will reduce to that particular area. Platelet aggregation, obviously, because it's a very important module in the process of coagulation. It happens very quickly. The first stage, hemostasis, happens very quickly. We all know, within minutes, 3 to 4 minutes, this will come into play. The stage 2 will be inflammatory stage. अभी inflammatory stage में क्या होगा? हमारा जो hemostasis था, उसमें vasoconstriction हुआ था. Next would be inflammatory stage. उसमें हमारा vasodilation होगा. Why dilation? Because अब जो हमारे important beneficial components blood से आने हैं, तो they will come to the site in abundant, quantity, in abundant proportions. तो अभी this stage will last from 6 days and it can proceed to many days, maybe even a week or 2. इस स्टेज में एक तो मैंने आपसे कहा था vasodilation will happen. इससे क्या हमारा फायदा होगा? इसमें हमारे certain enzymes and WBCs they leak out and come into the site and reduce inflammation. अब inflammation की हमारे वो 4 signs हम बहुत पढ़ते थे. Redness around the site, and then second was yes, then pain is also there, right? And also there will be dissipation of the heat because obviously the metabolic rate would be too high. अभी third stage जो हमारा है, that is the proliferation stage. अब proliferation stage को हम granulation stage भी बोलते हैं. Granulation stage is characterized by the obviously formation of granula, और उसमें क्या होगा? Re-epithelialization होगा, and there will be formation of new blood vessels to that particular site. अभी जब ये सब चीजें होंगी तो क्या होगा? The wound will start contracting. पहले inflammation में बढ़ गया था, अब क्योंकि healing में हम जा रहे हैं, तो wound will start contraction. Also, there will be neovascularization. New vessels will be formed. क्योंकि अब हम वो एक tense situation से बाहर आकर के एक normal situation में वापस आ रहे हैं. So now the tensions have to diffuse and we have to come to the normal proportions. This will also wound contraction अब किससे होगा? Fibroblasts, myofibroblasts will come and they will help aid in contraction of the wound. Then the final stage, that's called the remodeling stage. अभी remodeling